Good morning, everyone, and happy World Cerebral Palsy Day to everyone around the world. And this is to remind you that we'll be recording this session, and it will be available on the in the IAACD website. And if you don't like to be recorded, or if you'd like to remain anonymous, keep your video off through the session, and also you can rename yourself as a participant. I thank the International Alliance of Academies of Childhood Disabilities for giving me this opportunity. I'm Gopi Kitnasamy, Head of the Rehabilitation Services at Merrill J. Fernando Foundation, which is the charitable arm of Dilmati in Sri Lanka. Today's session is a very important discussion on diagnosis versus functional approach. And diagnosis, yes, it's very important to have a diagnosis, and it can be very helpful in many ways, particularly for clinicians to understand the condition better and also plan the management for the child, and also for the families to actually to plan the like where to go and where to take their child for the services, and also like on the management part, to be part of the management and plan for the future of the child. So diagnosis is very important. There are other benefits as well. Like when you know the diagnosis, you can understand the cause of the disease, which is very helpful not only for the patients and their families, and also for the clinician to sort of plan the appropriate intervention or medical management, or even the prognosis of the child. And in many instances, the parents sometimes they feel guilty whether that they have committed a mistake during pregnancy, and that's the reason for the child's condition, or like in some cultures they are even being blamed for being the reason for the child's condition. So once you know the exact cause of the condition, or when you have a sort of a accurate diagnosis, you don't need to feel guilty, and you can just focus on the caring for the child, and like even the next steps. And like it will be very easy for the parents to sort of contact the right people or the right service providers, and also to join support groups, like where they can get additional supports, like say if they have say if it's cerebral palsy, for example, they can join support groups which are with cerebral palsy, and sort of where they can get additional advisors, resources, and most importantly networking with peer groups, where they can sort of share the experience of the challenges of looking after children with special needs or developmental disabilities. And for the clinicians, like say when you have a clear diagnosis, they can actually plan the management and also decide on the prognosis of the child. And for the families, they also can decide on the future, like whatever the plans they can do for the child. So the diagnosis is very important. Also for the clinicians to sort of provide the correct medical management, and even for the families to understand why they are giving some medications for that particular child, on for what reason, and what medications they are giving for the child. So then exactly, so it will be very useful for them when they have a diagnosis. And for the clinicians, when they identify the diagnosis, and they can look for the other comorbidities and also the associated problems, and even organal involvement, so that they can treat those associated problems if there are any issues like that. And also when a genetic cause is identified, it helps to sort of start on the genetic counseling regarding the recurrence risk, because it's a very common thing when you have a genetic cause, the recurrence are very common. So is diagnosis is very important, yeah, but like, is it enough? But just having a diagnosis, is it enough? Or like there can be many instances where it's very difficult to make diagnosis in certain conditions, particularly some neurological conditions. It's very difficult to make accurate diagnosis. And for example, cerebral palsy can be sort of masquerade or sort of mimic by many neurogenetic disorders, and they can it will be like neurogenetic disorders with dyskinetic issues or spastic issues can very easily resemble like cerebral palsy. So sometimes it can be confusing and also can be end up in misdiagnosis. And correct identification of these other disorders are very important because then they can actually focus on managing those conditions. Even though we live in an era of most advanced neuroimaging modalities and molecular genetic testing, still we find it difficult to sort of make an accurate diagnosis. And what happens, sometimes it will end up with misdiagnosis, which is a very, very common thing. And so making an accurate diagnosis is very important. But like, is it possible? Like, are we able to do that in all instances or in all conditions? That's a big question. And also in the field of developmental disabilities, there are always debates and tensions and discussions regarding the best approaches for the child and also for the families. This actually is an ongoing thing. And also, like in some countries, the service eligibility is also based on the diagnosis. This puts a lot of pressure on the families to get a diagnosis and on service providers to give them a diagnosis or to make a diagnosis. This sometimes ends up in sort of dilemmas or like even in a sort of a difficult situation for the clinicians for making up a diagnosis in order to support the families for them to access the services. By focusing just on diagnosis, we are missing a lot of important information. So when we are in a situation where we can't make a diagnosis, what's the next step? So in many countries, many developing countries, low middle income countries, where the diagnostic test or even the genetic testing is either not available or very expensive for everyone. Like it's not affordable for for families from poor socioeconomic background, and in some countries it's very difficult even to get a genetic testing. Sometimes they have to send it across to another country to get it done. So that involves a lot of expenses. So the clinicians also will be facing a very difficult situation, like when they sort of write a diagnostic test, which is an expensive one, and they are sometimes they are like in they'll be thinking whether they have to sort of put the families in that like if they can't afford it. All these things put a lot of pressure both on families as well as the clinicians. And we have seen many children, even without diagnosis or with doubts of the diagnosis during our wheelchair and assessment camps. If you don't have a diagnosis, will you stop seeing a child or will you stop treating a child? No, we are not going to do that. So we sort of we'll be looking for their signs and symptoms, and then we can plan the management. This is a very common thing which we do in many countries, the clinicians. So we look for their signs and symptoms and then plan the management accordingly. A functional approach has been discussed and then in the field of developmental disabilities, and it has been proven to help to support children with developmental disabilities and their families. Functional approach focus on learning self-initiated activities through environmental and task modification and adaptation. This also supports the children to improve their abilities and also to optimize their functional independence. The family-centered approach and child-centered approach has been very effective, where the families get involved in the management of in the intervention, and that they can understand the interventions better, and then they can help their child in much better ways. Particularly in early intervention, this has been proven to be very effective, and this sort of helps families to be part of the intervention. Multidisciplinary, transdisciplinary, interdisciplinary approaches also has been very effective in the management of developmental disabilities. The Icf Framework, and this is a very nice poster which was created by the Can Child. We all are working together to help and support children with developmental disabilities to improve their abilities and optimize their functional independence, enhance their participation in all aspects of the society, and to become meaningful and also a productive citizens. There was a nice video on YouTube which was created by the CPNet on the Icf framework as well as the F-words. I'll just play this.
My favorite words. Have you heard of my favorite words, the F words in childhood disability? They all start with the letter F, and they mean a lot to me. They are related to the International Classification of Functioning, Disability, and Health, or ICF, from the World Health Organization. Please pay attention to these words when we spend time together at home, school, or during therapy sessions. These 6 words can help everyone understand what really matters to me. Some people are so focused on my disability that they forget that I want to grow up to be healthy and happy like everyone else. Here are my favorite words. Function. I want to do things. I don't care if I do them differently from other people. Let me figure out how to do things on my own. It's okay if I need extra time and practice to find a way that works for me. Family. My family knows me better than anyone else, and I believe they do what's best for me. Always listen to what they have to say. It's important that you talk to them, learn from them, and trust them. Fitness. I need to take good care of my body, especially while I grow. Please help me find ways to stay healthy and active. Moving and exercising are the best ways for me to find out what my body can do, which makes everything much easier for me. Friends. I need to have fun, learn, and grow surrounded by friends. I can learn from them, and they can learn from me. It helps all of us get to know each other better. It's so important that I have the chance to build strong friendships. Fun. I love this tiny word. I can have fun while I grow, learn, and have a blast. Can you help me discover what things might be fun for me? And can we find ways to have fun together? Future. The future is now. What happens tomorrow depends on what I do today. I don't want to let opportunities pass me by. Ask me and my family to dream of a future that is possible, and don't tell us what is impossible. Now that you know my 6 favorite words, please help me put them to good use every day. Are you with me?
Thank you. Hello, if you have any questions, we can discuss about any clarifications or questions here.
Thank you, Gopi, for a lovely presentation and nice representation from Sri Lanka. I'm so sorry to hear that Sri Lanka had such a bad storm and that your Wi-Fi is actually down. So I'm so pleased that you and Gayan actually have the chance to join us live. Maybe we can also listen to Gayan's thing, and then we can have a discussion between the few of us that have managed to log on.
Sure.
Thank you.
I think now you can see my screen.
Almost, Gayan, you have to start it. That's great. Yeah, thank you.
Diane, you need to share sound. If you go to the top, do you want me to share the recording? If you want, I can do.
Yes.
Or just go to the options and just share sound. Play the video again.
Okay, right. Shall I start again?
Yeah.
Yes.
And go to the top and then.
All of you, welcome to the World CP Day Global Listening and Sharing Session, which is organized by International Alliance of Academies of Childhood Disability. So this year topic is diagnosis versus functional thinking. So I'm very glad to say that this time participation of Sri Lanka is very much appreciated, and thankful to invite me to present my point of view regarding functional approach in Sri Lanka. So I'm going to talk about the functional approach for developmental disabilities in Sri Lanka. I'm going to introduce me. I'm Gayan Sanjeeva, physiotherapist, National Hospital of Colombo, Sri Lanka. I think you remember the date of today, so I'm going to wish you all happy World Cerebral Palsy Day. Then I'm going to give you the overview of my presentation. First of all, I'm going to give you the details of government and private sector collaboration to work with children with developmental disorders. Then I'm going to talk about the fundamentals of cerebral palsy functional approach in Sri Lanka. Then differential diagnosis and therapeutic framework in Sri Lanka, and how we use holistic approach and child-centered therapy in Sri Lanka. And at last, I'm going to talk about what is disability and what is different ability of the child. So now you can see the two extremities of managing developmental disorders in Sri Lanka. So then we divided into two sections, the government and private sector. Related to the private sector, you can see National Center for Children with Cerebral Palsy, which is owned by MJ. So then you can visit different private clinics which is related to the pediatric disorders in Sri Lanka, and those are the private sector institutes. And then when we consider about the government sector, so there are two major hospitals. Lady Ridgway Hospital for Children, which is related to the National Hospital of Colombo, and Peradeniya Sirimao Bandaranaike Specialized Children Hospital, which is related to Kandy Teaching Hospital. Other than that, there's a specific institute called IAACD, National Center for Children with Disabilities, which is related to the Ragama Teaching Hospital. So other than that, most of the teaching hospitals and other government hospitals, they have pediatric clinics and units to treat the children with developmental disabilities. And they have regular clinics and follow-up sessions to improve the functionality of these children. Then I'm going to talk about the fundamentals of cerebral palsy functional approach in Sri Lanka. I think you got a very good knowledge. You got a very good knowledge regarding the first 3 steps from the last presentation. And then I'm going to talk about the further plans and interventions in this functional approach in Sri Lanka. So in order to that, assessing the child, identify the key weaknesses of the child. It might be motor, speech, cognitive, like that. And then talk about the differential diagnosis and symptomatic approach. So I'm going to continue the session from planned goals with effective interventions. These interventions and these goals should be SMART. SMART means S means specific, M means measurable, A means achievable, R means reliable, and T means time bound. And we can divide these goals to 2 sections: short-term goals and long-term goals. According to these, according to the plan of the treatment, we achieve these goals one by one. So then we have to practice the exercises with the child. That is the important part of the functional approach, where we call it child-centered therapy. And the other part is the parental education regarding home-based exercises. That is the main part of managing these children in Sri Lanka. So because most of the time these children spend their time with the parents. So very important to educate parents regarding these home-based exercises. And then we have to routine follow-up. We have to do routine follow-ups and reassessments. And then we can plan new interventions for further improvements. And again, we have to do follow-ups and we have to take feedback by the multidisciplinary team. Then I'm going to talk about the differential diagnosis part and therapeutic interventions used in Sri Lanka. Most important therapeutic intervention is early interventions. So early interventions means we have to identify the ability and facilitate the child during his or her early childhood. So that is the key intervention when used in initial step. So then we have to progress of treatment plan using goal-oriented specific interventions. Those are like activity-based exercise sessions, and when we're doing these sessions, it should be fun and challengeable, and we have to give the task to the children, and we call it task-oriented activities, and we have to practice high disruptive sessions with children, for relaxation and improve strength by properties of the board. And here, sometimes we have to introduce assistive devices to facilitate mobility of the children. And most of the time, we have to contact prosthetic and orthotist to arrange different devices to control muscle functions and to avoid further complications in the future. We have to talk with speech and language therapists to get an idea about child communication capacity. And we have to do proper consultations of pediatrician to early drug management and follow-ups. And sometimes we have to work with a nutritionist to consider child nutritional demand with the activity level. Now you can hear these some approaches you can see here, and some are functional, like some different type of approaches. And here you can see balance and body awareness, and foundation and structural alignment, adaptations, developmental therapy, coordination and motor learning. This is very important part of a functional approach. And sometimes you can use hydrotherapy sessions, and we used some relaxation techniques and bimanual therapy, and like that of new techniques we used with these children to overcome their disability. So here you can see the international framework of ICF model. It's useful to approach different areas of management in developmental disorders related to children in Sri Lanka. So with that, you have to identify the GMFCS level of the child and prioritize the treatment, prioritize the specific functional and movement therapy to develop the children level up. So then I talked about holistic approach and child-centered therapy. Here you can see the summary of this child-centered therapy and how we use holistic approach here. As a physiotherapist, we have a major role in multidisciplinary team, and we have to practice holistic approach. Anyway, considering functional and movement wise, we have to plan exercises and made it to develop children's independent life with minimum or less restrictions. In Sri Lanka, now most pediatric physiotherapists practice early interventions and child-centered sessions and group therapy to make the sessions fun and enjoy. So they use different techniques and different exercise protocols to improve the child independency and how they have to cope with other children, and how they have to cope with the parents, and how they have to work with educational purposes, and how they have to communicate with others. And like that, you have to focus different parts to achieve functionality and mobility of these children. So at last, I want to focus on what is disability and what is different ability. So every child has a different ability rather than disability. So we have to identify those, and we have to facilitate child to improve their ability to overcome disability. In Sri Lanka now, basically focus the children independent life support with different programs and charity works. These types of every child has his or her own dream to be. So forget the disability and facilitate them and push to overcome their disability by empowering their abilities. So at last, I want to emphasize during this COVID pandemic time also, Sri Lankan physiotherapists as well as other team members of the multidisciplinary team try to help these children as much as possible to continue their treatment sessions without any obstructions. And so I'm very happy to say that like these children is doing their exercises properly, and parent support and family support, and we have to focus the background of the patients, and so that also very important part of this functional approach. We can't isolate the functionality, so functionality is coming through this background and family support and other factors which affect the functionality of these children. So then as a team, we have to do our job properly to help these children to overcome their disabilities. So at last, I want to give you a message. In Sri Lanka, our vision is to overcome the childhood disability through enhancing the ability. So this is our main task to do and to give you on this cerebral palsy day. So thank you very much for listening, and you can give your suggestions, and you can ask questions regarding Sri Lankan management after finishing this session. Thank you very much.
Thank you, Gayan, very much. Thank you, Gopi, very much for your presentations. Do you want to change to a gallery view, and then we can have a little discussion?
Gayan, can you stop sharing?
Johannes can probably provide us some insight before he has to possibly move away, and then I can actually guide some nice cozy discussion amongst the 5 of us, and then 4.
Well,
this is what listening and sharing is about.
Yeah, Gayan, can you stop the screen share so that we can put it in the gallery view?
Not sure if Guy is still with us, to be honest.
Hello.
Hello.
Gayan?
Yay.
Okay.
Hi.
Well, thank you, Laura, for giving me the opportunity. Well, I'm not sure if I can give you some insights, but first of all, I would like to congratulate you on your presentations. Very beautiful presentations. I was wondering, Gopi, you showed the ICF construction, which I really like, and I always think, but I'm not sure how you people think about that, is that the ICF construction the ICF model should be turned upside down, because now we first focus on the condition, and then from there on we try to script or try to analyze the different points of view. But if you turn it around, then you first look at the environment and their families and their social environment, their communication and so on, and how they play. And then there's a whole lot of nothing. And oh yes, this child has got cerebral palsy or spina bifida or whatever. How do you feel about that?
Like definitely in the child-centered approach, we sort of look at the child's ability and the condition first, and then so I think the ICF framework, like whatever at the moment, is I think it's a perfect for our approaches, because it's more a child-centered and a family-centered approach. So we focus on the child's abilities and also the conditions, and then look into the other factors which sort of contributes in the sort of management of the child's condition.
I think it's just so great that there is nice focus on actually changing the mindset of families and professionals to actually look at the ability of the child, not just the disability. And I think that is the crucial point, really, that, to gain acceptance by the community for individuals with special needs, because I know there is still, as you said early on in your slide, there's a stigma attached if you have a child with a disability, and things like this. I'm sure probably, how would you say the perception of disability has changed in Sri Lanka?
We have been working in creating awareness about disability, and particularly the focus on ability. See, if you look at our the initiative, the disability logo, so we have highlighted the ability, and this was a post-COVID response we initiated. And we also launched a disability YouTube channel in all 3 local languages to create awareness about the different developmental disorders. And also we launched last year, it's exactly the first anniversary of our disability screening app, which is the first of its kind in globally, because it can sort of help telescreen also, or provide teletherapy and connect with the multidisciplinary team as well. So during the lockdown, so all our services at our centers were sort of disturbed. So then we started the teletherapy services to support the kids who are registered at our centers. But we started it's a very new thing for Sri Lanka, teletherapy. So when we started in April, and then we did it for our kids, we saw some huge benefits of it, because we saw the family getting involved in the intervention, because they are in the lockdown, and we sort of the team sort of utilized that, because that sort of helped the family to reduce the stress in looking after these children full time at home, because other they will be at the center, then they will be supported by the team, and the family also can come sort of support during the intervention. But at home, it was not only with the kids, with the other due to the pandemic, they had other stress and psychological issues. So we were able to monitor them, and the team had a closer insight of those child's natural environment, and we were able to sort of interact with the family members, particularly the siblings, and we were focusing on the sibling bond, which is also a very important thing for the families with special needs. So the disability app, then we developed this disability screening app to support the families in the other areas where they have very limited access. And during the pandemic, they didn't have access at all, because they were finding it difficult to take the child for any rehab services, and also for the fear factor of infections. So most of the OPD services were either limited or they have stopped during the lockdown. So this was like a blessing for the parents and the families.
Wow, that
It's
sounds really
amazing,
great.
huh?
It's amazing. Yeah, I mean, the work you've achieved in such a short period of time is really absolutely brilliant. So you reach out to the people in rural areas as well, then I can imagine, in
Yes.
that way, and that would be more easy to do then.
Yeah, because some areas they have very limited access to multidisciplinary services, and during the lockdown, the transport service was completely stopped, and also the fear factor. So we started the teletherapy for our kids in April 2020, straight away after the lockdown, and we released this platform, this app, in October 6th last year. That was on the World Cerebral Palsy Day. So it's the first anniversary actually for us. And we have reached to nearly 230 families now from some remote areas of the countries as well.
Brilliant.
Marianne, do you just want to speak? I see your raised hand.
Yeah, I just want to ask a question regarding the telehealth therapy. I think, yeah, everything's wonderful, what you're doing. So have you found that most families have access to telehealth therapy, like they have the resources? Or do you think that there's families that you might be missing because they don't have a cell phone, or they don't have the right resources?
Yeah, that's one of our major challenges we had for the teletherapy services. That's why we were only able to reach to 230, but still we were able to reach to families who didn't have any access at all for other services. But like in Sri Lanka, using smartphone it's been now very common. Like a lot of people are using at least an Android phone so that it's easy for them. And this platform is available in both version actually, the Android and the iPhone version. So it's easy for the families to connect. And we are also trying to see whether we can set up satellite centers in different locations where they can come bring their kids to that particular location where we can provide teletherapy services at that center for those kids. So we have been working with some governmental organization to sort of initiate this new project. We'll be starting soon.
I know that the telehealth has actually been very helpful. And certainly what you suggest, where patients can go to a center where there's actually a therapist there who then can zoom in with the therapist who's at the specialist center, because there, I think, are limitations to telehealth. You don't have someone there to feel what you're feeling with the range, whether it's the spasticity or a contracture. And I've had some wonderful results with working with therapists in Sri Lanka virtually, where we can actually work together despite this long distance. And I think your access to the rural areas and things like this is an excellent thing. I want to know what's your magic. How did you manage to get the community to turn around and accept disability? Because that's a big thing.
So before we sort of launched this the platform, we actually introduced the YouTube channel in the local languages, which was because the families didn't have much resources, like say particularly on cerebral palsy, not much of awareness. We did the first ever like a national campaign on cerebral palsy in 2019, and we were it was in all districts. So it was on the October 6th in all districts of Sri Lanka. We did a massive campaign to create an awareness about cerebral palsy, because still, even though we have an estimated number of 40,000 children in Sri Lanka, still there's a lot of there's a lack of awareness about not only cerebral palsy, even other developmental disabilities. So our YouTube channel provided not only on cerebral palsy, on other developmental disorders as well. In not only we also created animatic sort of informative videos so that it will be easy for the parents to understand. Like say definition of cerebral palsy, one video, and then there was a signs and symptoms, and also the causes and risk factors. So it was very easy for families to sort of understand. And also we sort of did organized training workshops, webinars, and and on Facebook Live and stuff like that, because these are learnings actually from COVID. These are the positive side, because otherwise we wouldn't have started teletherapy things in Sri Lanka. So this was like a learning for us from COVID, and so that's how we were able to. And then once we launched the disability app, it was easy for us to reach to the families.
What an amazing job you guys have done. What an amazing job. We need to learn more from you.
Thank you, Laura.
Okay, and Gopi, is there anything more that you could, enlighten us how we can, make changes in the speed of light that you have done? How do we approach policymakers? Definitely cultural differences are a big hurdle that we face. And in Singapore, where we have a multicultural, multiracial, multi-religious society, it is very challenging sometimes because disability is taboo. It's amazing what you guys have done in Sri Lanka.
Thank you, Laura, and particularly on the satellite centers, which will be like a transdisciplinary approach. You don't need to have a therapist there. You can even train a sort of a community social worker or a sort of a public health midwife who sort of are well connected in the community, also well connected with these families. So if they come to the center, the multidisciplinary team can connect with them virtually and sort of help them, like even do individual sessions, group sessions. So that's what the plan, like that's what the next step for this platform.
And how about the families? Do they feel that this has been a very helpful way for them to bring their kids into the new world?
Yeah, actually, like see this during the lockdown, and we had nearly 4 waves of this COVID, and we had several lockdowns, and this was very stressful for families, particularly with children with special needs. And this has not only for the children to sort of get engaged on education, teleeducation activities, and also teletherapy services, but also for the families, like say we provide them with psychological support on sort of and advisors whenever they need, we can sort of even posture management, posture 24-hour posture care. Everything was possible through this platform. So which actually not only the blessing for families, it also for from the clinicians point of like from our team, it was very easy for us to sort of help them.
Will you be presenting this at the IAACD in March 2022? Because it sounds like your tools that you've used are really quite helpful and can actually benefit countries, a lot of countries. Marianne, I'm not sure which part of the world you're chiming in from, but I know certainly having access to this kind of information would be really great.
Yes, I 100% agree. I'm based in South Africa, and yeah, I mean, we have a lot of rural areas, and it's been a very big challenge. And what we found is that the only thing that's currently been working with us is WhatsApp, which is very limited. So I agree that more information on how to set up satellite services, etc., would be wonderful.
I think if it's WhatsApp, I think it's even great, because if your infographics and things like this can be put on a PDF, you can then WhatsApp it to people.
And
yes, 100%.
Yeah. And on this app, actually, we are trying to the next steps, because this is at the moment, it's only available in Sri Lanka, because in the local languages, because you need a multidisciplinary team and an organization to sort of manage and support the families who connect in the platform. So we are trying to expand it to like globally, because we wanted to sort of for others to use it or use this useful platform, because this also, why I said this is the first of its kind globally, because it can do telescreening, like from developmental screening, disability screening, and even the dysphagia sort of screening as well. So it's an all-in-one package. So, and it's very easy. It's available already in English, Tamil, and Sinhala, the local languages. So this will be very useful for anyone to sort of adapt to their country. And it's like those questions all based on the WHO disability screening question and also the CDC developmental screening question. So anyone can just adapt it to suit the local settings, actually.
Wow. Gayan, do you have anything else you want to add? Because I know you worked really hard to actually make therapy fun for kids, and the kids that I see, you wouldn't have thought. I don't think they've ever complained about having therapy. They enjoy the therapy, and I think that's what helps them move and do more. And the family, when the family sees the kids happy, they actually then are more compliant.
Yeah, I want to share my knowledge. Like, I'm not engaging in the clinical setup, like I'm doing home visits and that kind of sessions. So we have to work with most of the time we have to work with the parents and children, like their family. The background is like family. So then it might be very enjoy and challengeable. So otherwise, it's very boring to the child. and the parents also. So my practice is basically on the activities. With the activities, I'm doing my session daily, and I want to give a little bit of challenges day by day. So, and that's how I organize my exercises with the challenges. So parents are also very helpful, and they are doing their best to the children. So I always update exercises through the WhatsApp, and they also always contact with me to get the feedback. And if I miss sessions during this pandemic time, so they always try to update me by every 2 days, 3 days, like they update me. So then I can again change the exercises and update them. So like that, they are doing a great job here. So the other thing is they are not changing therapist. So that is the main thing. Like if they change the therapist and then again we have to do reassessments, and so then again that improvements might be delayed due to that lack of yeah. And so I think you can hear me, no?
Yes, keep going.
Yeah. Okay. So that is the main thing in Sri Lanka now. So my two children are different, like one is hemiplegic and one is quadriplegic. So then we have a challenge to introduce exercise to them. So basically those are like with the age and with the family support, and sometimes mother is too close to the child, and sometimes father is too close to the child. So we have to identify that points also, like when you have closely practice with the home-based exercises. So then we have to reach to that parents, mother or father. So we have to introduce the most of the exercises to them. So then they can practice with the child. So that is the main thing I focus. So Sri Lankan, different like knowledge also, like parental educational level, so background of the child. So we have to consider all that factors around that. So that is the main thing we have to focus in the rural areas. So we have to go, practice more with them and other. So then they can get a more idea about that physiotherapy, and that is the key thing we have to focus when we are practicing in home-based exercises. So our clinical setup is too different from that part. So a lot of equipments, and so it's very systematically functioning unit. So, but home-based exercises, we have to arrange things, some different things we have to arrange by themselves. So then we have to give the same a little bit of idea about that, and then we have to push them and motivate them to make them, and then we have to practice those things. So that two ways, like we have to do as therapists, we have to do our part, and at parental side, then they have to give that feedback and that support also. Then only the child get improved. So, and other thing is the psychological support and the other teamwork, like my multidisciplinary team, like we have to do a consultation, proper consultations and feedbacks. Then only because it's a home-based setup, so I'm only one member of the multidisciplinary team. So we have to take the ideas of the other team members, and we have to get the support from orthotist. So then we have to contact those people outside. So then only that mechanism is going in a very good positive way. So that is the main thing I have to emphasize, like when you're practicing in home-based therapies in Sri Lanka. So I think Laura know that part because I work with you more than 1 year now. So that is the main thing, practicing in this like home-based therapy sessions. We have to practice that kind of things in Sri Lanka. Basically, that is child-centered therapy with fun and enjoy, like activity-based therapy.
Thank you, Gayon. Gopi, shall I leave it to you to wrap up?
Yes, thank you. Thank you everyone who joined the session, and thank you from Sri Lanka, and once again, happy World Cerebral Palsy Day to everyone. Thank you.
Thank you. Thank you, Marianne, for attending.
Thank you, Laura.
Thank you,
Thank
Gayan.
everyone.
Thank you, Gopi.
Thank you.
Bye.
Bye.